It looks like we have a full group. Thank you all for joining. I know I sent the notification out a little bit late, and I am so grateful that you guys took the time to join this morning. We will have kind of an abbreviated meeting. We are scheduled from 9 to 10:30 or 10 to 11:30, and we may go the entire time, but I know people know and never mind getting minutes back in their day. So we just wanted to make sure we touched base in November, making sure our cadence going in the right direction. And I'm going to ask, if you're not speaking, if you put your phone on mute, that helps with the kind of the backfill that we're hearing while I'm still admitting folks. And so welcome to our crisis task force meeting. And I know all of you know me. I'm Alicia Clark, and I'm the Assistant Director of Community Planning and Collaboration with the department. And we are excited to continue this work moving forward. You know, I'm really impressed with how wonderfully attended these meetings are, and I'm very impressed with the eagerness of this group to continue to work together and get to the end result. I was talking to the contractors yesterday,
614-419.
This report is
emergency. Please send me a text, and I will respond as quickly as possible. Thank you.
So if you are on the call, if you put yourself on mute, if you're not talking, that would be great. People are really getting the buzz and the information about this report coming and are really awaiting this report. I said yesterday, this report is going to be kind of like the birth of Jesus, but Ken quickly corrected me and said, not really. So this report is really being anticipated, though. We're so excited about the buzz that it is creating. People are looking forward to having a list of vetted recommendations from the community, from our partners, our stakeholders, to move this work forward. We're so excited, and we're continue to be excited about your participation. So for today's meeting, the one thing that I wanted to talk about here early in the task force is our membership. And I'm going to pull up the membership roster. And I'm going to ask that first, before we introduce ourselves, if there are any new members that are joining the meeting for the first time, we'll give you the chance to introduce yourselves first, and then we'll go around and have folks just introduce themselves. So I'm going to call on you, Peggy, because I saw you join the meeting, and I know this is your first meeting.
Sure, absolutely. I'm Peggy Kuhar. I'm the nursing director over at Akron Children's, and I'm over the behavioral health unit here, and have also had experience with adult behavioral health units in my past as well.
Well, welcome, Peggy. We thank you for joining. We're so excited to have you here. And I wonder if Andy was able to join us this morning.
Yeah, Alicia, I was. Thanks. Hi, my name is Andy White. I'm a Director of Health Economics and Policy at the Ohio Hospital Association, and I'm also our staff lead for behavioral health. So thanks for having us as a part of this group.
Thank you both for joining us. We appreciate it. Are there any other new members that are joining for the first time today?
This is Molly O'Neill. I've been on the 988 task force, but I have not been here for this larger group, so I'm glad to be here. I'm with OCAR.
Molly, thank you so much for joining us. We're so glad you're here because we'll have you kind of play a role here later in the day when we're talking about our membership and needing some folks with lived experience to join some of our committees. So we'll be really depending on you to help us fill those roles.
We'll be very happy to do that. Thank you.
Mm-hmm. Anyone else that's a new member today? I'm excited we're having new members. That's exciting. Okay, well, we'll go through a really quick introduction. Just if folks can introduce themselves. I know that most of us know each other. Most of us are on committees together, but it's always good for us to hear who's at the meeting. And so if you would introduce yourself and just maybe tell us a little bit about why you're here, if you haven't done so already. So I'm going to start with Hillary Hamlin, because you're the first person I see in my box.
Good morning. Yes, I'm Hillary Hamlin. I'm working with Chris at Healthcare Perspective. I've done a lot of work in Ohio in the past and looking forward to helping with this project.
Thank you. Next person.
I'm Michelle Allison Smith. I'm with Coleman Health Services, and specifically, I'm the Chief Officer of Coleman Crisis Services in Stark County, Ohio.
Welcome. Okay, we're going to have to speed this up a little bit. So, Tom, go right ahead.
Hi, I'm Tom Craig. I'm the Director of Behavioral Health for PEGS Foundation, and we're here as a funder in Ohio and interested in crisis response, and so that's why we're a part of this. Thank you.
I'm Scott Osicki. I'm the Chief Executive Officer of the Adams Board of Cuyahoga County, and crisis is very important, and that's why I'm here.
I'm Joan England. I'm the director of the Mental Health and Addiction Advocacy Coalition. We are also delighted to be here and see the need for a full crisis continuum in all the counties that we're in. Thank you.
I'm Sherry Walter with the Ohio Association of County Behavioral Health Authorities, and we represent the boards, and all of the boards are interested in crisis right now. So we're just trying to make sure everybody's on the same page, and all of our boards are very interested in where we're going with 988 and crisis services across the state. So we really appreciate the opportunity to have representation at this meeting. Thanks.
Alicia, Luke Russell with Deputy Director at NAMI Ohio, part of the 988 core team, and also lead our efforts on person-centered mental health here. So obviously crisis fits right into that. Thank you.
Good morning. Stephen Hedgepeth with Healthcare Perspectives, supporting Healthcare Perspectives and Zia Partners in completing this landscape analysis, and happy to be here and add where we can.
I'm Precious Dubey. I'm the Adamus Board Director from Hancock County. I think I'm here to make sure that if anybody has any history questions, there's an old fart on the call.
This is Scott Rasmus, the Executive Director of the Butler County Adamus Board. I'm on the call. I think we have a pretty good, robust crisis continuum in Butler County and extending it to a crisis stabilization unit. And just to learn from you all and see what, sort of goals and plans we have moving forward.
Good morning. This is Ruth Samara from the Coordinating Centers of Excellence at Northeast Ohio Medical University. We've got 3 coordinating centers, one at the Criminal Justice Coordinating Center, the Best Practices in Schizophrenia Treatment Center, and the Ohio Program for Campus Safety and Mental Health. And Crisis Services is pivotal and touches on all 3 of the centers in terms of our statewide TA work. Thank you.
Hi, I'm Sully Hernandez. I'm an Associate Director with the Ohio Council of Behavioral Health and Family Services Providers. So we represent about 160 behavioral health organizations across the state, and many of them provide crisis services.
Hi, I'm Terry Russell, Director of NAMI Ohio. We believe this is the most important issue facing the system, much more important than 988. 988, we're very supportive. We'll follow whatever you guys do. But if you get a call and you don't know where to put a person, and that's what happens every day in our office. So we need to move this crisis as fast as possible. Thank you.
Okay, it sounds like, did everybody get a chance to introduce themselves?
Good morning. It's Teresa Lample with the Ohio Council. As Sully already introduced, we represent the treatment providers, the crisis providers, and like Terry, the crisis continuum has been an area of concern, particularly since behavioral health redesign, and that this effort is much needed to make sure we have a full continuum of crisis services available in all parts of the state. So thanks for having us and the effort that's underway.
Good morning, Erica Bruns, Director of Acute Services at Nationwide Children's Hospital.
And good morning, everyone. It's Matt Parrish. I'm a captain with the Columbus Division of Fire. I'm the fire chief of staff, but I also oversee our co-responder and multi-discipline teams that respond to overdoses and mental health calls. And I'm one of the leads on our project here locally, developing the right response unit and alternative responses for the crisis care and working with our call center. So I have not only a lived experience as a first responder and a provider, but also as a family member and an individual. And this is something that has been necessary and needed in my almost 30-year career, and I'm just happy to be a part of it now.
Good morning, everybody. This is Eric Heiner, also with the Ohio Council, and I am here to listen, learn, and contribute as I'm able.
Alicia, do you want OMA staff to introduce?
Sure.
I'm Vicki Montesano. I'm Bureau Chief of Mental Health Treatment. I think Lois is on the call as well.
Good morning. I'm Lois Ostetler. I'm Assistant Director for Community Treatment Services. And obviously I'm with the state, so I have a vested interest, but I also have a long career in criminal justice and behavioral health in the community. So excited to see application and boots on the ground, as we always say, from the community to help drive what we're doing at the state. So thank you for your participation.
Hi. Oh, sorry, Lynn Lyon. I'm here on behalf of the Department of Medicaid.
Hi, and I'm Bobby Boyer, Deputy Director with the Ohio Department of Health Services Prevention Office, and I have Stacy Frederick-Hassan on the call as well. And we've been working on the 988 process and are happy to link our arms together with the entire crisis team here.
Good morning, everybody. Stacy.
Okay, I think we just admitted Melissa and Scott. So Melissa, if you could introduce yourself, and Scott.
Yeah, Scott, I already did. I just got kicked out of the meeting. That's all. I had to rejoin.
I know, I did too. Hi, I'm Melissa Knopp. I'm the manager, the program manager for the Ohio Stepping Up Initiative, which is a national initiative to get severely mentally ill folks out of the county jails.
Mm-hmm.
Hi, I'm Alicia Smith. I'm with PEGS Foundation as Director of Policy and Implementation, and Tom already described why we're here. Happy to be here. Thanks.
Okay, you'll hear from the contractors that we've acquired here very shortly. But I think, piggybacking on what Terry said and what Bobby said is really how are we linking arms with this work, making sure that not only that we have an adequate call center, but we have a place that people are able to respond to, a mobile crisis where people are able to respond, and a place where people can go and be stabilized. And then, of course, in Ohio's continuum, we include Thrive, which is what does that look like when the person is leaving that stabilization environment or that hospital environment? And so I think that it's just this committee is so important in making sure that that work is braided together. So as you're part, some of you are part of the 988 committee and this committee as well. And that role would be helping us braid that work in a way that is seamless for the folks that are having to go through the system. And so we want to make sure that not only are we lifting up a call center that's going to be able to connect people to care, but a mobile response opportunity that's, an opportunity for deployment and referral, and then a stabilization opportunity for people to be stabilized, whether that's any array of those stabilization opportunities. And then where do folks go? after they're stabilized, and where are they going to go after they're leaving the hospital settings. And so I think, Terry, what you said was appropriate for this morning, just kind of as a foundational thought as to why we're here and why the importance of why everybody's here today. So thank you for that. You know, as we're looking at one of the reasons I wanted everybody to introduce themselves is so that we can look at who's missing from the table. And so there are a couple of groups that one of the charges of this task force is to leverage your relationships, your partnerships, your collaborations to ensure that we have the right representation on this task force. And we're still looking for representation from our MCOs. And I know that Lois and Vicki and I are working on that. We're looking for representation. You know, we have some additional hospital partners at the table, which is great. We're also going to be looking at some of our state psychiatric hospital CEOs to bring them into the table. We're also thankful for OCARS joining today and looking forward to Ohio Pro when they're able to join, and looking for those individuals and family members that have gone through our crisis system. And so are there any other folks that I haven't mentioned that might be missing from this list that we would want to include in this very important work? Anyone else that you can think of?
Alicia, this is Joan England. I think one of the things that we're always trying to be mindful of is thinking through things from an older person's lens as well. So perhaps some groups representing older individuals, if they're not already included, could have a real useful perspective.
Mm-hmm. I think that's a great addition.
Alicia, this is Lois. I don't think we have anybody with experience in developmental disabilities. That's something that we hear a fair amount, like working with the Multi-System Adult Project. So I don't know if there's someone that could join from a county board of DODD or DD.
That's a great idea also. I noticed in the chat, I did miss one group that we had talked about already, is our first responders. Captain Matt is kind of spearheading this single-handedly, and we would love to have some additional partners so that we can have at least a first responder representative on each of our committees so that we can have that perspective. So Matt, we will be charging you with looking broad and wide at your constituents and your partners and seeing if there's anybody that's available to join this committee, and also all of us to look. And of course, they would be cutting my grass at the time that we're doing this meeting. So if you hear that, I apologize. But all of us too, looking to see if there's some first responders that would be appropriate to bring to the table. We had a first responder lead in the department, and we are replacing that role, but we have not replaced that role yet. So we're still looking for some strength in that space.
Yeah, one thing that would be helpful, Alicia, in the first responder department is to think specifically about EMS, ambulance companies. Transportation is such a big issue, and there may be an ambulance association or some such in the state that represents collectively. Another thing to think about is non-Medicaid insurers, Medicare Advantage plans or others that can contribute to crisis services for the majority of Ohioans who are not on Medicaid or indigent.
Yeah, Pressure put that in the chat as well. So you and Pressure were on the same page there, Ken.
Related to, I'm sorry, this is Ruth. Related to EMS representation, there's a gentleman by the name of Jeff Jackson, who's the director of EMS in Sandusky County. I suspect he gets tapped quite a bit because he's very forward thinking and thinks about mental health crises a fair bit. But he would be, I think, an excellent addition. I'd be happy to make a connection.
Mm-hmm. And Ruth, while you're bringing that up, I wonder if we have the judicial representation that we need on this committee also.
Yeah, that's interesting. There's certainly a number of mental health courts around the community. There's a couple of judges I can think of that kind of reach back, if you will, and really think about prevention and diversion and deflection, maybe more so than others. But I'll give that some thought too.
So Alicia, I'm part of a national committee for the state court administrators and chief justices group that's focused on these issues. And you know, I've been very impressed at the contributions from the state judicial leadership level and the interest in this. And, you know, there's somebody from Indiana, for example, that's one of the major movers of that group. So I don't know if there's someone in Ohio who would be in that role who might be interested in this, or identifying someone who would be representing the state court perspective, all the state courts.
Alicia, Brett and I would be happy to figure out the judges for you. We know the judges really well. And I used to run the specialized docket section, so I can definitely identify if you want mental health court judges, if you want a specific type of judge, just let us know. But we could give you a list of those.
Absolutely. Absolutely. Thank you for that.
Mm-hmm.
Someone put in the chat CIT supervisor or trainers as part of when you're thinking of first responders. So think about that. I think that's a good idea. And then the Council on Aging in Southwest, and we can certainly have our aging lead in the department reach out. That was a great addition also, Captain Parrish, to say who are our faith-based partners. I know that Joseph Hill is a part of our work group, part of this committee. I don't know if he's on today, but that's a really good call out on faith-based partners. We know that they're still one of the first lines of defense out there in the community when people are experiencing a crisis. They tend to call their clergy. So that's a great addition to the team. So if you have any recommendations for individuals, yep, Joan, LGBTQ also, that would be a great opportunity for us to be broad and wide with our representation.
So Alicia, I might have missed this, but do we have anyone from like ODE or any of the schools? Because I know with kids, you know, a lot of the crises kind of either start or end in the schools. So that might be an area to consider.
That's a great idea too. I'm going to leave that, you know, pitch that one to Bobby to kind of find someone to join. And most of the time, these folks can be joining our committee work. I don't know that we need, you know, 15 more members to the task force, but we certainly need more members on that committee work really to drill into the work that we're doing. So if you have ideas of those types of folks, please send them to Chris, Ken, and myself. And then we'll make sure that we can reach out to them and get them plugged into the right committee or plugged into the task force in general. So last time we met, we talked a little bit about the committee structure. And so today we wanted to just keep the momentum going, make sure that folks knew that we were moving forward with that structure, and have the consultants come and present where they are with some of the baseline information gathering, and then a little bit more detailed information on the committee structure. And then we'll have a little time for us to kind of reflect back, take your feedback, hear from you, if there's any suggestions, any changes, or any outstanding questions that you still may have. And so I'm going to kick this over to you, Chris.
Thank you, Alicia. I always want to start, and especially since we have so many new folks today, and really appreciate the new participants, to kind of orient everybody again to what our scope of work is and what we're trying to accomplish. So the main purpose is the landscape analysis and a set of recommendations for statewide, regional, and board approaches, including SWOT analyses. Also working with the department on local continuum crisis planning, providing recommendations on interventions and sustainable methods to fund those interventions going forward, advising on collection of data for the crisis continuum, integrating this work with the other work that is ongoing at OMOS, and a lot of those topics have been discussed today. creating a lexicon, which we've started the process of that with the definitions, but it's just a starting point. We have a lot of work to do in getting a common language for how to talk about these services. And then also taking a deep dive into select communities to inform the study. So for those that haven't been exposed to that before, we're looking at, as we're getting the data back from this data collection that we're going to talk about in a second, which communities that we're going to focus on to kind of get a little bit broader understanding and picture of exactly how services work in operation and what the challenges and barriers are to those services. So what we wanted to do today with a quick status update is talk quickly about the data collection and where we stand with that. The due date is the end of this week, and we'll talk about kind of status of that. And then talk about committees and where we stand with membership and chairs, and a little bit around charters, kind of a starting point for what the approach is going to be for each of the committees and what their areas of responsibility are, so that we make sure we've got a good definition on that moving forward, as well as a schedule, kind of benchmarks of where we want to be at different points in the project, just so people understand, how we're going to meet our deadline, and kind of keep people oriented to where we're going to be in the process at different points. So if they need to be a little more selective about their engagement, they'll know, sort of roughly where we're going to be at different points in the first part of next year. So we'll walk through that today as well. In terms of the data collection, it was distributed on October 27th to all of the boards, as well as to this committee. The intention being that the boards are going to be the respondents, but that you were aware as committee members of what we were asking for. There was also a webinar that was distributed with that, and we had a question and answer period with OACABA and their membership the following Wednesday after it went out. The due date was set for this Friday. We have had one submission already, and actually was early last week. So we really appreciate that board for being very proactive and getting back to us with their information. We have had multiple requests for extensions, and have granted those. We appreciate the folks who have asked for specific reasons to have a little bit more time. We're not moving the date generally, because we'd still like to get as much of the information by this Friday as we possibly can, but we certainly understand that circumstances come up, and would appreciate specific contact from boards if they need a little more time. But again, pushing as hard as we can to hold to our dates, because we want to be able to consolidate this information and put it out for validation. And that's really the period that we're going to lose if we start saying, well, we can wait until mid-December to get the information back. We're going to lose that opportunity to get the validation that we really want to get from the broader community about, is this the complete information? Are there other services? Are there other data that we can collect about different areas that maybe the boards didn't have ready access to, or did not get in their response, that we could add to the data that we have available? So that's kind of the update on the data collection. Any questions, comments on where we stand with that? Oh, one other thing, we have been distributing questions and answers about every couple of days, in terms of where we're getting questions. When we respond, we're consolidating those and sending them out to everybody on the committee, as well as the boards, so that everybody gets the same answers to any questions that have come up.
Yeah, and hi everybody, this is Ken Minkoff. I just wanted to add that we're hoping to start to flow the data collection as we get it into the committee work. So it's going to be a parallel process, because we're on such a fast timeline. So based on the information we gather, we'll be explaining the time frame of the actually getting the committees to start meeting in December as we go through this. And part of the goal is, the more information that we have to look at, we can start to, at least provide some high points of what we're learning as we go, even before we've completed a full analysis of all this information. So be aware that this is not like data for us. It's data for the task force to help do the work that the committees are tasked with in order to create the recommendations that Alicia was talking about earlier.
Thanks, Ken. And I apologize, I should have introduced myself. I know we have new members. I'm Chris Villema. I'm the CEO of Healthcare Perspective, and Healthcare Perspective and Zia Partners have been engaged to assist the department with this work.
Yeah, and I'm a Zia partner.
All right, we will move on unless anyone has any questions. Into committees. So again, reorientation for those who have seen this before, maybe new orientation for some of our the new folks that have joined us. We've broken this work into 6 committees. 3 of those we're seeing as service-specific committees and 3 of those as boundary-spanning committees. This also allowed us to absorb the existing 988 committee structure into this work as the connect portion of the continuum for crisis services. So that is not a new committee, the upper left-hand corner box. That is the existing 988 committee structure. So we are forming 5 new committees as part of this work to cover the respond and stabilize and thrive portions of the continuum from a service standpoint. And then for the boundary spanning committees, a committee on community crisis coordination, a committee on performance metrics and data, and a committee on financing the continuum. One of the things I wanted to kind of present today is sort of a framing of what the intervals might look like in order to get us to our target of June, and roughly what the committee work is going to look like over that period, understanding that every committee is going to be a little, might be a little bit different. We're trying to hit certain benchmarks along the way so that we're making sure that we're going to be able to do what we need to do within the committees and get to where we need to get to. So our plan is to start with orientation at the first committee meetings in December and finalize the concrete tasks for these committees. So within the charters, we've got some broad tasks, but we want to get more specific about exactly what questions we're going to ask within those committees and what work we actually need from the committee members. And then in January, hopefully we'll have that data collected in a more complete format. We'll certainly look at some initial data as part of the formation of those tasks in December, but that will be dependent on what we get back. And then in January, we'll have a more complete, at the January meetings, the evaluation of the data that's been collected to date. February, roughly, those meetings would be the evaluation of best practices. So we'd be bringing both committee members as well as the consultants, bringing different best practices to the table to be talking about in comparison, and to address some of the questions that are coming up. And then start looking in March at how we incorporate and which best practices we might incorporate, as well as other recommendations, starting to form those in the March and April timeframe. And then May, really assimilating all of the various recommendations that are going to come from those different committees and make sure that we're coordinating across committees if any adjustments need to be made, or we need to do anything to better coordinate and ensure that we're not making counter recommendations from different groups, and that all the pieces fit together, if that makes sense, in the May timeframe. And then June, really having a chance to review the report and what it says, and make sure that the committees are comfortable with the pieces that they were asked to work on have been addressed in the final report. So hopefully this gives you sort of a framework. Again, each committee is going to have its own co-chairs, and exactly how this lays out for every committee may look a little bit different. Some folks may move faster in some areas and slower in others, but just roughly, in order to get the work done, we're roughly going to have to be on this kind of timeline. And happy to take questions or comments on this or anything you feel like we're leaving out.
Yeah, and so let me just add a little bit that our perspective on this, and we'll go into this a little bit more later, but every committee is going to have co-chairs, as we went over last time, one person from OMAS and one person from one of the community partners. And in our view, as the consultants, these are your committees, and as the co-chairs are really responsible for, holding on to the overall what's really important for this committee to do. Our job is to staff, support, organize, do all the scut work, synthesize information, and help the committee do the painful work of creating real useful products. And we're going to be available as consulting team, all of the 4 of us on this call plus others, to do that work and to partner with the co-chairs, and we'll jump in and do as much as folks need us to do to help the committees to be successful. At each meeting, for those of you who are participating, everybody's going to get to work. Everybody's going to get an assignment each meeting to do something for the next meeting because there's lots to cover and everything is going to get built in small steps the way that Chris has depicted. But, that's, because there are many different tasks that are covered by this work, how that proceeds will depend on the tasks in each committee and so forth. So we'll be helping this to be organized, and each month the committees will be reporting back to the larger task force to gather additional information and to report on progress. In addition, everybody who's participating in the task force and everybody in the committees, part of what we're hoping for is that you are able to reach out to key informants and experts in various areas throughout the state and bring that expertise into this work as needed. So people may not be committee members, but they may be asked to contribute to a certain piece of product that's being developed. And we're going to, need to work with everybody to just be thinking as you're sitting on this committee, what reach do I have? Who can I engage? What are some of the areas of expertise that I want to bring into this, even though that person may not be a regular committee member?
Thank you, Ken. Precious got her hand up.
Precious always has her hand up. So back to the names of the committees and the scope of the committee. In the crisis roadmap, there were 2 constants in every section, and one was this performance metrics and data, and the other had to do with the source of accountability. And so I don't see any committee related to accountability. I guess I'm wondering, is that an expectation within the charter of each committee that they would be addressing where they interpret or what their recommendation is in relationship to the point of accountability?
Pressure, we're thinking that the Community Crisis Coordination Committee is right on that. So the question is, at the community level, meaning the board level, essentially, how do we all work together to hold accountability for collective performance, as well as for, the other tasks of making sure that we're, sharing the ability to, to share information and track people through the system and all work as great partners to make our local system work. So that's what we're thinking would fit under that committee.
Yeah, and I would also think that accountability would be a part of every recommendation in terms of who's accountable for that, what that recommendation means and who has responsibility for implementing that recommendation. There would be an accountability component there as well.
Yeah.
Awesome. I just want to make sure we don't leave it out.
No, that's an excellent point. Thank you, Pressure. Solly, you got your hand up.
Yes, thank you. So just, thinking a little bit about the conversation we had yesterday and thinking about these committees, and I know workforce is a huge struggle. We all know that. We hear that everywhere. And I think it's going to come up probably in every single one of these committees. But I just wanted to put that out there that workforce needs to be something we're all thinking of as well. And I know we'll probably get more specific details. I don't know if it makes sense to have a workforce subcommittee or not, but just something to consider.
Yeah, Soli, you were probably bugging our after meeting discussion yesterday when Chris and I and Alicia kept going after the end of the meeting with the provider group. So there is a larger workforce effort that's held up at the state that Alicia was talking about. And we did not create a workforce committee because we didn't want it to, the workforce issues are very, very broad. And we didn't want to like try to have competing pieces of energy. However, we too, after yesterday's meeting, were thinking every one of these committees is going to go off into like talking about the workforce challenges. And we need a place to hold on to that within this structure where people can talk specifically about workforce recommendations related to recruitment and retention and certification of people who are going to be working in the crisis continuum. And one of the things we're actually planning to bring up a little later in the meeting, but since you raised it, is we were thinking maybe we could incorporate that as part of the work, because it is kind of contained. We could make that be part of one of the committees and include it within its task. And we were hoping to get some recommendations from the group about which of these committees seemed most relevant, rather than trying to start a whole other committee, which would not be our preference because we have to support all these things and we're already like stretched as far as we can go thinking about supporting 5 and all the subtasks. So that's just to be completely transparent about that. So if you have some thoughts about where it would belong, I think, you can make an argument that workforce is going to come in everywhere, but crisis workforce in particular could be tucked into a variety of different committees. So we can come back around to that as we talk about the charters and see what people think.
Yeah, but that is one of our discussion questions later on. Anybody else on the intervals or anything about the structure? And we're going to dive into charters and membership next. There was a chat comment from Matt. Challenges may be different for each committee. Maybe each group addresses it individually specific to their function. That was another suggestion on the workforce challenges. We talked about that as well. As Ken said, the danger in that approach is, or the potential in that approach is, every committee gets drawn down, that discussion and doesn't, move forward on some of the other pieces as effectively if we put it in every committee. But it's something we need to discuss and figure out what makes the most sense. All right, so let's go committee by committee. The Respond Committee, sort of and I should have put draft on this. It's a draft charter. We want to have more specific questions within the charter as well, but also want the committee chairs to have input on that. So we're kind of trying to put a definition on this without having worked with the chairs individually yet on these charters. So the Respond Committee is really charged with the service descriptions and service standards, recommendations around those for the parts of the crisis system that are part of Respond. So we outline, some of those things that are included in Respond or Mobile Crisis for Adults, MRSS, the walk-in behavioral health urgent care services, as well as transportation, we're putting under the Respond Committee's area of responsibility. So this is another example of something that could potentially be in multiple committees, but we're proposing housing it in Respond, as transportation is a topic that could cross, but trying to compartmentalize it into one of the committees and make it one committee's responsibility. And then this statement about subcommittees and work groups will be organized to focus on specific elements is in the charter for every committee. So just kind of laying out what all is in Respond is the Respond services, what's involved in delivering those services, and that certainly includes the standards and the service descriptions and how we talk about Respond services. So questions about Respond before we get to committee members? Okay. So this is what we have based on the volunteers we have to date. I've tried to highlight in red where we believe we still have gaps. There may be other gaps that you want to identify or let us know about. We're proposing that Tom lead this committee as the task force co-chair. Grace, Wilma, and Alicia will be participating from the department. On the OMA side, Hillary and Ken from the HCP and ZIA teams. Ken and Alicia, I think, are the two consistents across all 5 committees. Ken and Alicia are listed on all of them. We're changing up who's the HCP person is on each of these, but they're the consistents across. OACABA has nominated a few people, Fonda as a rep from the staff side, and then several board folks. The providers that have been put forward are listed here, or people representing providers. Erica has volunteered from the hospital side, and then M from CCOE is also a volunteer for this committee. So just understand as we go through this, these are the folks that have stepped forward and said they're willing. We still have a need for an advocate or someone with lived experience or both on this committee. We have a law enforcement first responder need on this committee, and we have a managed care need for this committee, and perhaps other payers as well.
And Respond includes co-responder programs.
Yes.
Which may provide a clue as to who the law enforcement first responder people might be. And transportation implies that we might want EMS first responder on this as well.
And Joan just put in the comments that Megan could serve in the advocate role. I know Joan and Megan have stepped up in the advocate role on several committees, so I don't want, folks to get too overcommitted, because this is going to be a good bit of work. But certainly as we'll take any volunteers who volunteer as best we can accommodate them.
OCAR will help fill the lived experience roles and the advocate roles as well.
Excellent. Thank you so much. I forgot you had already said that. That's excellent. We'll definitely take the OCAR reps as well. All right. Moving
I also
on.
see that Captain Parrish put sign me up for the law enforcement role.
Okay. I wasn't going to pressure Matt for all of the law enforcement roles because it's a need across the board. So you may want to think about which committee, because I don't know that you have the time to do everything, but we appreciate you stepping forward.
Well, yeah.
We've got a couple of hospital folks as well.
Yeah, that's awesome.
Volunteered. So Peggy and Andy for the hospital roles. That's excellent.
Awesome.
And we've got some hospital gaps on some other committees too. So, we'll can talk about that as we go forward, that we have Erica on this one already, and, we have gaps in the other committees. So.
Right. And if you realize when we go through the other committees that you made a mistake signing up, you really would rather be on another one, that's perfectly fine. But, we do want to fill them all out. So,
yeah, and we're happy with the numbers that we have. We just know we have gaps to fill. So we're probably going to be pushing 20 on most of the committees when we get fully fleshed out, but that includes the OMAS members as well as the consultant members. So, we're okay with that number, knowing that there's gaps that need to be filled on all of these committees. But just so you know, I think we're at 15 to 17, 15 to 19 on the 5 committees so far. So we got good response. We really appreciate everybody that responded and volunteered, but wanted to take the opportunity to walk through these just so if other folks do want to step forward, we'll certainly accept those nominations and are happy to have additional members.
Right. And just be prepared. We're expecting the first meeting of each committee to be occurring between December 2nd and December 10th. And we're going to doodle poll. So we can figure out which committee time is going to be best fit. And then we're going to try to get a regular schedule so people can plan ahead for each committee monthly. Yeah. So just be prepared. It's a fast moving train.
Yeah, so we've gone ahead and blocked out some times that we can support from the consultant side and use those as the potentials to survey the committee members and try and get the best times for everybody in those first couple of weeks of December.
I wanted to thank Tom for agreeing, hopefully, to be the co-chair of this, and just to thank Pegs for being willing to support each committee as well with distribution of membership. So
yeah, you'll see Pegs as a role on the other committees. It's just that Tom is serving as the chair, so we have other roles.
And Tom, you are excited about this, right?
I think we may have.
Yes, I'm fine. I'm fine.
That's great. That's all. Just wanted an endorsement.
That was easy, Ken.
I had faith in Tom.
You aren't supposed to ask questions you don't know the answer to in front of this many people.
I know.
All right.
We had a talk with Tom, and Tom was the right man for the job, so we're excited to have him there. But
Yeah,
Tom did Ken was asking me 3 or 4 times, "Are you sure you talked to Tom? Are you sure you talked to Tom?" I said, "Yes, I talked to Tom."
And you'll see on a couple of the other committees, we have TBD for exactly that reason. We've had volunteers, we have discussions ongoing for a couple of the other committee chairs, so that's why they're going to be TBD. So we don't have chairs for all the committees yet, but we will shortly within the next few days, if not first part of next week, because we are going to be meeting shortly after Thanksgiving. So we'll move on to.
There's a couple of comments in the we may want to address.
Yeah.
One is, would we want to include someone from probation? And Melissa, talk to us a little bit about the probation individual that you're thinking of, or probation lens that they could lend to this work.
Yeah, I don't think a lot of folks realize that when folks are put on probation in Ohio, especially in the Common Pleas Court, they're on probation for 5 years usually. And a lot of times what we see is when there's issues in the community, if there's like a 911 call, the probation departments will share their list of probationers with law enforcement. And so if they do get a call like that, a lot of times what law enforcement will do, if it's not a new crime, is they will just have the probation officer respond. And so we are really going to be trying the next couple of years with stepping up to integrate probation a lot more in with different trainings and just making sure that they're at the table. Because one, they supervise folks for 5 years, up to 3 to 5 years is what the term of probation is for a municipal or common pleas charge. And a lot of times they're the ones that are kind of the first responders in these areas, because usually that's who family members or folks will call if their person, if the person under supervision is having troubles. They usually won't call law enforcement if they know that there's the probation officer who can come out and deal with it. And I just think this is a discipline that we haven't really included a lot in some of our stuff. They really need training and support, and they're very interested in coming to the table. There's the Ohio Chief Probation Officers Association, which is their trade group. We could go to them to get a rep. I would say to put them on the overall big task force and then let them figure out what subcommittees they think they could benefit, or you could benefit most from their experience on.
Yeah, that's great, Melissa. And the most important of the committees, based on what you're saying, would be the Community Crisis Coordination Committee, because every community is going to have its local probation office that needs to be, connected to the local system. But, obviously people can participate in whatever they feel they would be interested in contributing to.
Yeah, and I think that's the committee I volunteered for, so.
Okay.
So I think that I agree. I think criminal justice, that would be kind of the piece where we would have most contact, but I don't want people to not recognize that a lot of times they're dealing with some of these issues when folks don't want to bring in law enforcement and have the big hoopda, if there's an issue.
And then Molly also made a couple of comments about must have people with lived experience. We absolutely agree. I mean, that is our, that is our desire. There's a lot of must-haves on these committees that we may or may not get. So that's our, our desire absolutely is to have somebody with lived experience on every committee, just as we have some other roles that we desire to have filled, but we don't have names yet. So that's
Yeah,
what we're
the other thing is we also want to have people who think about children as well as people who think about adults, because those lived experiences diverge in many ways. So keep that in mind when you're finding folks.
Andy asked a question that's more about the survey. And Ken, I don't know if we want to take this back or if you want to respond off the cuff, or if I should respond off the cuff about why we didn't ask specifically about emergency departments at general hospitals that don't have psych units in the survey. If there was a reason not to ask about that, or do we view that as being incorporated in the survey but not specifically asked?
You know, I'm going to jump in there. We actually have some information, and so we removed a lot of information that the department has already. And so some of the questions, you might see some information that we didn't ask, and that some of that is specifically because we've already asked for certain data from those entities and have that data at the department ready, and we'll be sharing that data so that we'll have a comprehensive look as we're doing this landscape analysis.
Thank you.
Yeah, and we were also trying to balance, you know, from some of our initial discussions with the boards, we know that in most boards there are lots of emergency departments, but there's a subset that they work with more regularly. And we wanted them to report on those services because they're a little bit more organized around behavioral health response. And we didn't want to have them feel like they had to contact every emergency department in their area to find out, you know, whatever they could, when, as Alicia said, we have other sources for that generic data.
Yeah. And it is a good opportunity to reemphasize that the survey is not the end all be all for all data that we're going to be using as part of this process, that it's just one component, a significant component, but just one component.
And we'll be looking to you, Andy, and your group to help us make sure that we are inclusive in all of the hospital information that we add into this document. So great question, and keep your lens out for the things that we may not have thought about as we're moving forward. So we really depend on your lens for that.
Absolutely, we would really appreciate any thoughts you have, Andy, and others on, you know, areas we might be missing.
Appreciate that outreach. Thank you.
And NAMI also, Luke stepped forward and said that they would appoint a member with family or lived experience to each of the committees as well. So that will be hugely helpful. Thank you. All right, stabilize and thrive. We talk about this committee is also looking at service descriptions and service standards, but in the stabilized part of the continuum, as well as connecting to thrive, as Ken has emphasized before, and I've been trying to continue to emphasize that, you know, we can't encompass everything about thrive into our scope. There's so many services that are part of ensuring, and so many other components that are part of ensuring someone thrives, that we can't necessarily address all of that in the work that we're doing. But we want to make sure that as part of the stabilized work, we're making those connections to the thrive part of the continuum, and that we're examining those and making sure that those are part of the standards and descriptions and how we go about doing these other services. But we list out here some other examples of other services that would be in the stabilized part of the continuum, and then again, subcommittees and work groups organized to focus on different aspects within this scope. So, questions about what the Stabilized Thrive Committee will be doing, or comments?
Yeah, and let me just add that this area, I mean, I like Respond, but probably even more with this area. Part of what we're going to be gathering from the first quick look at the surveys that we sent out is where these different types of services are operating and what they look like roughly. And that information is going to contribute to the committee work, because part of the challenge in doing service descriptions and service standards for Ohio or any other place is you want, you know, good standards for people to adhere to, but you don't want them to be so high. You want high standards because you want everybody to do a great job, but you don't want them to be so high that people who are operating services can't do them anymore. And there's no right answer for this. It's just a natural tension of system development. And we're really going to need a lot of good thinking about, how to make sure that we help all the existing services continue to grow while at the same time creating meaningful standards, for the system to aspire to. So I'm saying this because any of you who are contributing to this, I'm sure you already have some thoughts about this. And this is some of the stuff we're going to get busy on right away when we start to meet.
Excellent. All right, so committee members for Stabilize and Thrive. We have some gaps here as well. I've already talked about the advocates have stepped up and said that we'll have those roles filled. We still have a hospital need here as well, and managed care. Do not have a task force co-chair yet, but we have some options there that we're just working through. Board representatives, provider representatives, and then you see the OMAS, Vicki and Alicia on this one, and Stephen from HCP is along with Ken supporting this committee work.
Yeah, and Andy, this is, obviously there are different components of the hospital universe that contribute to different aspects of this. And we're probably going to want to reach out and touch base with you separately so we can learn about your world as consultants and think with you about how best to contribute to the total effort. I myself am a recovering hospital system medical director, so I kind of know what it feels like to be on various ends of this discussion. But one of the issues is, for this particular thing that we included was the issue of admitting people to the non-state hospital units and what the various issues are in terms of facilitating the process of admitting acute people who have various types of coverage or no coverage or whatever. And this is a really important issue on as part of the system. So we want some really smart people contributing to that discussion.
Any other comments or thoughts on this one? All right, moving on. Community Crisis Coordination. This committee is charged with the recommendations and best practices for coordination of the crisis systems at the community level, including the boards, the providers, the hospital system, law enforcement, first responders, county and local governments. I need to add first responders in there. People with lived experience, state agencies, public and private funders, including the Medicaid MCOs. And that speaks also to the recommendation or thought from earlier that we need to include other payers beyond just Medicaid in this, and the boards and OMAS. The scope of this committee includes, but not limited to, and this is one that, we're just throwing out some markers on this. There could be a bunch of things that end up being a part of this, but defining the processes for community collaboration, identifying mechanisms for sharing information, developing procedures for client-specific care coordination, describing the components of the crisis system within each region, and describing the framework for planning within state hospital regions. So.
Yeah,
that's the CCC charter, or beginning draft of a scope of a charter. All right. CCC membership. Also, this is another committee that we have to be determined. We do have volunteers. We do have others that we're talking to about potentially being co-chairs of this committee. Pretty robust membership. But this is one we only had one board representative on this one. And then we do have provider representatives. Joan and Megan both volunteered from the advocacy side. Law enforcement and managed care still needs on this one. And Ruth and Melissa also volunteered for this committee, as well as Erica from the hospital side. Again, open to, other suggestions and membership on this one as well.
Yeah, and because this is you know, in relationship to Precia's earlier question, this is really a lot about how at the board level, there's the opportunity to create collaboration that shares accountability for the local system. We would really encourage more board representation in this committee, and particularly boards who may have diverse board experience, if you will, in terms of size and shape and location and whatever, levy, non-levy, however you want to put it in. So even though this is well represented, this would be helpful to have more than one board representative.
Any other comments, questions? I think folks wanted to be out by 11. So we're a little bit past, but we've only got a little bit further to go. Performance metrics and data. We've tried to spell out some specific asks here a little bit more in terms of performance metrics and those that can be used both to look at performance at the community level as well as access and DEI issues, rural versus urban, adults versus kids, MH versus SUD. Obviously, there's a lot here we know, but there's also, you know, a number of things that we can sort of start with and say, okay, here's some possible metrics. Let's look at, you know, how we get to what we need to do from a data and metrics perspective. So I think this one's probably fairly well understood, but certainly happy to answer questions in terms of what's incorporated in the performance metrics and data group. But we're looking for, you know, metrics for the system in various different aspects. This one solely had volunteered, and we are taking that voluntary step forward with Solely to chair this committee. Craig from OMOS will co-chair, and Alicia and Ken, as I mentioned, are on all the committees. This is one that I'm helping with as well. And we do have a law enforcement and managed care gap on this committee. And again, just one board. Scott is the board representative on this one, a few providers, David from PEGS, Megan had stepped forward on the advocate side, and then we also had Natalie and Melissa that volunteered as well for this committee.
Sherry's got her hand up.
Yeah, I think you guys are missing. I sent a couple of lists because I had more members for these last couple, so I'll resend it, but I had sent you guys a couple of lists, and Alicia, and there are several folks I have sent that are not on these committees.
Okay, we may have just missed it in the entry to the spreadsheet then.
Yeah, I'll make sure you get it again, but thank you.
Okay. Apologies for that.
Oh, no problem. That's no problem. You guys got a lot going on. I'll just resend it. It's not a problem at all.
Yeah, and Sherry, just, you know, I'm gonna just say this, you know, you may look around as you scan this and say, I have usual suspects and hand raisers, but I need to get some of the people in who may not normally raise their hand because their perspectives are often missed. So feel free to do that if you think that makes sense.
Yeah, and I think John noted, but we have a meeting later today, and I can talk to folks and try and get you some more members, and I'll get you an updated list too, along with the list I sent.
Perfect.
This is Teresa Lample. With this group in particular, with data and metrics, I think we need to, you know, make sure we not only have folks from managed care that cuts across not just Medicaid, but this may also be a place where having Medicaid participating in this process is critically important. As we're thinking about data and metrics, there has to be some level of consistency of what we're measuring across multiple different payers so that we're not burying people in data and data collection. So I just think that those are a couple places in particular we should probably consider for this group.
Appreciate that.
This is Lynn. I can take that back and try to identify who would be the right person within ODM to participate.
Yeah.
Lynn, I'm going to ask if you could take back each of the committees. I know there's a lot of committees, but the more representation we have, I think the better. So if we can maybe identify just a couple of folks, I know we're all kind of tasked right now. But I think that would be important.
And as we say that, financing the continuum certainly is one of those that would be important to have Medicaid as well. But yes, all of the committees would be helpful. All right, so the Financing Committee includes broad recommendations for funding strategies as well as specific recommendations for funding models for services like mobile and crisis center with observation, considering OMOS funding, Medicaid funding, board funding, other payer funding, and other federal, state, and local funding sources, engaging those partners, financing strategies, financial incentives. Obviously, a lot of looking at best practices here as well in terms of how other states are financing their crisis system, other possibilities of financing will be the topic for this committee, or the set of topics for this committee. I had another volunteer that we are accepting that volunteer to step forward on this one. So Presha, we would love to have you co-chair this committee. Doug Day as well from OMOS co-chairing. Again, Alicia and Ken Hillary from the HCP team. A number of provider. I missed board entirely on this one. What was I doing?
No, you had
Oh, no,
Presha.
okay, Presha was.
But we need more board people, so hopefully, yeah.
And then
yeah.
manager also being a need on this one.
So I mean, I think this is pretty self-explanatory, but there's an overlap between the parts of the committees that are designing services and service standards, and then how are those services funded. And part of what we plan to do is to kind of help everybody stay in the right lane, but work in a complementary fashion. So the financing committee is looking at broader funding strategies and then connecting that to, okay, how does that relate to what this particular service looks like and what kind of funding support it needs?
Okay. Soli, you had your hand up?
Yes, hi, thank you. So first, happy to chair the data committee, so thank you for that. And also for including us on all of the committees. So the one committee that the Ohio Council didn't have a rep on was I think the Respond committee. And so I think I was the one who was going to participate in that one. So if I'm happy to do that, if there was a reason you didn't include me, I'm also happy to not do it, but I would like to be included if possible in that committee too. Just not as the co-chair, obviously. Tom will do a great job on that one.
Yeah, I think
that was just an oversight solely.
Yeah, I think when we were slotting chairs and, yep. I just left you out.
All right, perfect. So thank you so much.
I think we got a good feedback already on the who's missing. Oh, and we have another hand who's got their hand up. Oh, that's still Soli's. Sorry, never mind. I feel good about the feedback we've gotten on who's missing already. So if you have further, comments on that, please do. Any, thoughts that folks have on the right chairs? I think we're going to, we have those two that we still have to be determined and we're working on, but
Chris, can you just talk about the first meeting that we're planning for us and the chairs?
In terms of giving a date and time, or that means?
Yep. Tell everybody that we've got this all lined up. So.
Well, yeah.
Now that you've said you are okay with being a chair, we immediately have something for you to do.
So we're hoping that we can have the first committee chair, the meeting of the committee chairs with us, and that would be both the OMOS chair and the task force chair, the co-chairs, with the consultants on December 1st from 2:30 to 4 o'clock. Hoping that will work for folks. If not, we've got some other times that we can look at, but we're trying to hold that time and see if we can make it work for most people.
And what we want to do is kind of, help all the chairs realize that we're all a collective team managing this process. and go over what do the co-chairs do, what do we do to support the co-chairs, and kind of find out from those of you who are co-chairs what you guys are thinking is really important right out of the bat, and how to best support you. And we understand each co-chair pair is going to be a little bit unique, but we want to create some consistency of operation as we jump into the first set of meetings. So that's going to be a very important level setting, orientation from our perspective. And we really hope that people can prioritize attending that.
As you might have caught a glimpse of, I just popped that up on my calendar and forwarded it to Tom and Prescia and Soli. So,
Yeah, and I think that the slide that you had earlier, Chris, that describes the steps, that identifies kind of where each of the committees, what work we want to accomplish, is going to be important, because again, we have such a short amount of time. 6 committee meetings is a short amount of time to really come together and get the work done. So I just thank everybody for your tenacity in getting the work done. I see, Sherry, you have your hand up.
Yeah, I just had a quick question. I noticed you didn't really go over the 988 committee earlier on, but I'm willing to co-chair that one if you need a co-chair from the task force, because I'm spending so much time on it anyhow and working closely with Stacy. So if you need someone, I'm willing to do that.
So we are leaving we're leaving the 988 committees intact. Stacy's done a good job with that. So we are going to, as we talked about earlier today, really linking arms. I think Bobby said it really well, is linking arms with that committee, making sure that work is coordinated. This is our opportunity to braid that work together with the rest of the continuum, as Terry mentioned this morning, the importance of that braiding of that work together. So thanks, Sherry. I also want to just give the director, Chris, joined us today, and I want to give her an opportunity to say a few words.
Good morning, everyone. Thanks so much for your continued efforts with this task force, and with all of your efforts in implementing the crisis work in local communities as well. I did have conflict for the beginning of the meeting, but wanted to just listen in and learn alongside all of you. And as always, we are committed to this work. You know that it's a priority for the governor, and one that he's made sure there's a priority in our budgets, but also we want to make sure not just that we have a lot of resources, but that these resources get used wisely and in a way that really does help Ohioans and support the workforce and helping too. So I just want to say thank you again for sticking with us through this project, for all of the work that you've done over the years to lead us to this point. We have such a strong foundation in partnerships and relationships and vision, and just echo again our commitment to being supportive throughout this process and helping to lead it as well.
Thank you, Director. That is much appreciated. This team is working very hard, and we're really impressed with the connectedness, the collaboration, and just impressed that folks are still at the table with us, moving this work forward. So thank you for that.
Sure.
Were there any final comments on the committee structure, or was there anything else, Chris and Ken, that you wanted to identify for the group on the upcoming meeting?
I think we still want to talk about the workforce issue and where best to house that. Is there any further comment or thought on that?
We have about 10 minutes, and I think the workforce issue, for those that were joining late, is we were in a meeting with the Ohio Council and the providers yesterday, and one of the big topics that came up during that meeting were the workforce challenges that the crisis providers are facing. We know in the behavioral health system, our entire behavioral health system is facing workforce challenges, but we got to hear directly from those providers some of the concerns that they're having. And so after that call, Ken, Chris, and I thought we would think about where workforce fits in this work, knowing that we have some bigger, broader strategies that the department is going to be leading here very soon. And so just an open conversation. The comments earlier were maybe workforce is going to be included in each of the committees, or maybe workforce could be included in the collaboration committee. And so I think we can still open that up for continued discussion.
So I'll say, I think a couple people in the comments have said it makes sense to discuss in all the committees, and I would agree, especially those service-based committees, because the issues are probably going to be unique depending on the service. But just knowing that, yes, we have a workforce shortage across the entire field of behavioral health, but then even more so for crisis. So these are non-traditional hours. These are, working with more difficult populations, sometimes more dangerous, or, people feel less safe in these circumstances. So those are all things to consider. We know from our membership that we're hearing they're not even getting applications for these positions anymore. And so that's just something I think it's unique that within the behavioral health workforce, these crisis positions in particular are even harder to fill and really require some of your more highly skilled clinicians. And so, it's not just finding people, but then also taking the time to really train them and ensure that you train them to provide quality services and then working on retaining them. So I think there are a number of factors, but I think it makes sense to have that as a point of conversation. And I'm sure it will come up naturally in many of these committees anyways.
Yeah, Sully, I think having a locus of discussion in both respond and stabilize thrive, and paying attention to the particular types of workforce issues in those domains, I think that makes a lot of sense. I'm sure the issues will come up everywhere, but at least speaking for myself, I would like to see specific recommendations coming out of the committees to say, what can we do, particularly in the short and intermediate term, to enhance the ability to recruit people as part of this. And you have said this many times, we can design a perfect continuum, but if we have no people to work in it, it's not going to do much good. So, and we as kind of the glue that holds us together, when people start going off track in another committee talking about workforce, we want to say, hey guys, take a breath. There's a group over there that's working on that. If you have ideas, send them in. We'll get them over there. But let's focus back on the thing that you have to do, whatever that thing is.
And
I think
Maria, go ahead.
I was going to say, Teresa. To that point, Ken, the other group I think that has to have a conversation about workforce is the financing committee. We have to be able to adequately finance this. In the work we've done with Ohio Rise and MRSS, Medicaid plays a role, but Medicaid can't completely fund the type of workforce setting of a 24/7 model. So how are we going to do that? And I think those strategies have to also be fully considered in terms of covering the total cost of care of what it takes to offer crisis system services. So I would be remiss if I didn't see that as a priority or workforce being clearly identified as a responsibility under the financing committee as well.
Yeah. Yeah, and I think, so the way I've been thinking about that, Teresa, is exactly the way you've been framing it. Like, we have to finance in a way that's consistent with workforce need. But I wouldn't want that committee to go out into all the workforce challenges other than we have to finance that. So if we could allocate that, I think that would make more sense. I mean, do you see that differently?
No, I don't think so. I think, Teresa, I see that Prescia completely agrees that it needs to go in the workforce. Thank you, Co-Chair Prescia. But I think this is going to be an important issue for the entire report, right? It's going to be an important issue for the work moving forward. And we're just trying to align how this work is identified and what we need to do so that we're not duplicating work that's already going on in other places. And so the OMOS staff that's a part of each of these committees will be abreast of the OMOS workforce strategy so that we can kind of guide and put some guardrails around how far and how deep we dive into that particular topic. Does that satisfy what you were thinking, Teresa?
Yeah, I just think we need to make sure as we're thinking about, the financing, it has to include what it's going to take to recruit the crisis workforce.
Absolutely.
That's the critical part. And then once you have the workforce, it's the training and the experience and the development and supervision, all of which also feeds right back into financing. And many times we don't always contemplate those costs when we're building a system. I think the other thing, we get caught in our system in saying, everybody wants to be the payer of last resort. We have to have a conversation around who is the payer of first resort. And how do we manage that so that we have a comprehensive blended braided opportunity to make sure that services are being paid for in a way that makes sense.
We totally agree.
I'm so glad you're on the financing committee, Teresa.
Thanks for twisting my arm, Ken.
So with the last 4 minutes of the call, does anybody else have any comments, reflections that they'd like to add to the call? Well, this again was another successful joining of us together, just really getting ourselves moving forward. Again, that 6 months goes by so fast. And I just want to thank you already for the work that you guys will be doing in those communities and helping us put together a comprehensive landscape analysis that will move this work forward in Ohio. That's really the goal, is how can we put ourselves in a good foundation to continue to move this work forward on the policy lens, regulatory lens, funding lens, workforce lens, and then of course the system design lens as well. So thank you all for joining. The next meeting is December 14th. Everybody have a happy holiday.
15th? 15th? 15th?
Is it the 15th?
If it's a Wednesday.
Well, let me check.
Hey, Sherry.
It's the 15th. Thank you, Ken. It is December 15th. And you all should already have a meeting invite.
Yeah, and stay tuned for the doodle poll because we want to have all the committee meetings by the 15th. So we're on that track. And we hope to have the final co-chairs identified and see you all in the co-chair meeting on December 1st.
Yep. Thank you all. Have a great rest of your day. And again, happy holidays.
Thank you, Alicia.